Hello, good afternoon. Today we are going to talk about how do I manage infections because infections is a very important part of orthopedic practice. It might elevate your practice or it might bring down your practice because infections are very disastrous in orthopedics. It not only affects the patient financially, it leads lot of many socio-economic problems. Sometimes families get shattered because of these infections which occur in orthopedic practice. So what are the problems mainly what we face in handling with these infections? That is, one is financial distress because patient will be spending some lakhs and lakhs of rupees to get rid of this infection, and sometimes they don't get rid of infection even after treating for 9 years, 10 years. So imagine a patient who cannot walk independently, who has a non-union of the femur, and he is having discharging sinus from where the pus is coming out regularly, and he has spent a lot of money, has gone to many doctors. Sometimes they go to 3 4 doctors. By the time they approach me, they might have spent already 40 50 lakhs, 60 lakhs. There are people who have spent 70 lakh rupees also. Even after that, the infection have not come down. So because of that financial distress, they will go into financial distress because they have to spend a lot of money on this. Second thing, adding to this fuel is loss of doubling the problems of financial distress is loss of employment because many people don't cannot work because of all these problems. So they remain at home and then they lose their work. Some companies provide work from home, but not all companies are providing that option. So some private employees, if you are a software company employee, you might have, and sometimes you'll be always wasting your insurance. You will not have any insurance coverage. You have to spend from your pocket. All this leads to depression. Mainly, they go into psychological depression. This depression will negatively affect the outcomes of our orthopedic problems because it reduces the immunity. It loses the patient loses the confidence because patient having confidence is more important because when patient feels that when his inner self feels that he can cure this disease, he will win over the disease. But when his inner self is distressed, he will not be have the courage to face the problem. So that will lead to another problems for us, leading to accumulate the problem, vicious cycle. So this infection will remain in his body for many years. Some people die with those infections. What are the risk factors? Why do you get infection in orthopedic? One is patient related factors. Second one is trauma related factors, medical management related factors. What is patient related factors? Patient might be having diabetes. Maybe his vascularity is not good in the part where there is infection. Second thing is he is a smoker. A smoking increases chance of non-union. So that will lead to repeated surgeries. That repeated surgeries might cause infections. So other thing is patient is obesity also leads to many other problems in orthopedic problems. And secondly, we see trauma related. So it is not compulsory to have an open fracture only to get infected. So the chances of infection are very high if you have a open fracture. But even in a closed fracture also you might develop infection because it depends on the severity of the injury. Always it is important to remember that a bone is the pillar of any house. Like pillars, you have constructed a house and the house is supported by pillars. So bone is also the same, takes the same function. Bone is also like a pillar which takes supports your soft tissues, your internal organs, and you help you in moving out and also maintain your posture, height, everything. So when a pillar is gone, the building collapses. Same here, if your bone is fractured, that means it is the severest form of soft tissue injury. So it's not that easy to break a bone because it is very hard. So when a bone is broken, the surrounding soft tissue has to take a lot of trauma energy. So even in closed fractures, there are chances of infection because of the severity of the injury. If the injury is very severe, suppose a person has fallen down from height. If a person if a person has fallen from height and then after some time that injury and something has again fallen over him, and like you see it is in the building collapses, earthquakes. So there will be crush injuries where you get trapped inside in the area, where the rubble is on you and you are under the rubble. So because of that also increases the chance of infection. And another thing is when you have a trauma and if you have severed your artery or nerve, so when there is artery, there is no blood supply. That will also increases the chance of infection. So medical management related effect. So sometimes what happens, antibiotics are not used judiciously because earlier started changing antibiotics very frequently, and then they have not done proper culture and they have started using other antibiotics. So slowly this bacteria will develop antibiotic resistance to the medication. So multi-drug resistant infections are the other main problem with these trauma related infections, orthopedic infections. So what are the patient related factors? They are older age, poor nutritional status, existing medical conditions like diabetes, chronic lung disease, weakened immunity, and history of substance abuse. Severity of injury. Just now we were talking about the severity. When there is a severe soft tissue injury, even in closed fracture also, that periosteum gets peeled off from the bone. So that will reduce the blood supply to the bone and bone will go into infection and non-union. Contamination of wound with foreign debris. When there is a fracture, open fracture, grade 2, grade 1, grade 2, open fracture, okay, that's they are fine because you can usually do debridement and close the wound. But in grade 3B injuries where you cannot close the wound, you have to go for plastic surgery procedures. And also extensive soft tissue damage. That's what we are talking about. Is a fracture is the severest form of injury. So medical related prolonged surgery. Sometimes the surgery is lengthy. The wound is open for much longer time in the operation theater, or the wound is not debrided timely. So these are all lead to the injury. Need for ventilation. So patient is debilitated, very severe form of injury. So that he needs ventilation. Ventilation, he will be very malnourished, and then he will start having infection, blood transfusions, and also indwelling catheters. If there are any catheters in the urinary tract, that will cause a urinary tract infection, or sometimes catheters to transfuse fluids and blood, they will get infected, and that will spread to the trauma area. Inadequate wound care. So we are going to discuss a case. See, this is a case where it looks like a simple fracture on a X-ray. It is only a distal tibia fracture, both distal tibia fracture. Initially, it was operated at another center. He came to me after 1 year or 1.5 years after I was operated there with a small wound at the fracture site medially, and also there is infection in the knee joint. So in this case, the infection has spread from knee joint to the from fracture site tibia to the knee joint because he is having intramedullary osteomyelitis. So he has developed intramedullary osteomyelitis. So that infection has spread to the knee joint also because the proximal entry point from here, the proximal entry point is communicating with the joint, and the pus has entered into the knee joint. So distally also this joint is communicating, the pus is communicating with the ankle joint. So he is having infection at three places. One is infection in the knee joint, second one is infection at the fracture site and a non-union, and third is the infection from the fracture site is spreading into the ankle joint. So what we have done, we have removed his nail, then I have opened his wound. We did intramedullary canal drainage. Then we have put stimulant beads, opened the knee joint, opened the ankle joint through the fracture pieces, did proper debridement, gave proper wash to the joints, both the joints, and then we did elision. And in this X-ray on the left side top, it is post removal. The fracture has healed, he is walking. So this is another case. This is an international patient where he is having fracture because of bomb blast. So he's having around 20 centimeter shortening. First, initially, he was operated at another center. That center X-ray is operated at another center where they have done corticotomy in the middle of the tibia. They have distracted it for another 10 centimeters. So after coming to us, he has a non-union at the docking site. and also he's having extensive infection along the skin, but there are no open wounds. So we have removed the fixator, existing fixator, cleaned the fixator, cleaned his limb, everything, and then we have taken him for surgery after 3 weeks. After 3 weeks, we have put Elizaro, and then his fracture has healed. He is also having equinus deformity. That deformity is corrected, and then using Elizaro, we have achieved plantigrade foot in this patient, and all the fracture has healed. He is having another 7 to 8 centimeter shortening, which was distracted with the tibial distal tibia fracture set. So this is another elbow where they have done elbow fracture, where they have done K-wire fixation to the elbow, and that got infected. Now we have removed elbow K-wires, then debridement first stage, then second stage plating I have done without exposing ulnar nerve, and she is having good ROM. So this is another case of diabetic foot where he was advised surgery or amputation. He did not want. He doesn't have blood supply. So we have done debridement. We have done Elizar or tibial cortex distraction for this case, and then he was we did the serial dressings. This is photo of 4 weeks post surgery, and this is the case where he is walking. He is having triple vessel disease. He had uh, he had triple vessel disease. He had triple vessel disease. Is like a ticking bomb. He survived our surgery. He did not get CABG also done. He is still surviving. It is post 4 years post surgery. He is doing very well. So this is another case where she underwent diabetic foot deformity. This is equinus deformity. The diabetic foot is that they will have infection cured, but sometimes because of the deformities, they won't be able to walk. So we have done Elizaro distraction, achieved complete correction of the foot frame. This is another case of diabetic foot where he has infection of the great toe, which was going for amputation. We have done uh, what do you say? Elizaro distraction. His toe is saved. Thank you. ఎవరు ఇందాక వచ్చింది